Hello everyone. I am Dr. Samir Dani. I'm a cardiologist. I'm Director of Cardiology Services at Apollo Hospitals Bhad, Gandhinagar and Apollo CVHF Heart Institute, Ahmedabad. I'm going to talk to you about high blood pressure in young people or hypertension in young adults. What is hypertension? Hypertension is basically high blood pressure. What is blood pressure? Blood pressure is measure of force of the blood pumping against the blood vessel walls. And when the blood pressure is higher than normal, it is called hypertension. What is normal blood pressure? Anything that is 120 by 80 millimeter mercury or less. When the blood pressure, upper blood pressure or systolic blood pressure is 120 to 129, it is called elevated blood pressure. When it is more than 130 up to 139, it is called stage 1 hypertension, and above 140, it is called stage 2 hypertension. The diastolic blood pressure corresponding values are 80 or less, 81 to 85, 85 to 90, and more than 90. When the blood pressure is over 180 by 120, systolic and diastolic, it is called hypertensive crisis. So, what causes high blood pressure or hypertension in young adults? Well, advancing age, diabetes, and certain kidney diseases cause high blood pressure in many elderly people. But in young adults, the commonest risk factors or commonest associations are unhealthy lifestyle, number one. Number two, family history. Now, what do we mean by unhealthy lifestyle? That includes faulty diets. Most of the people who are hypertensive are salt sensitive, means that higher than usual or normal salt intake causes high blood pressure. Apart from that, high calorie, lot of oil, high fat, high carbohydrate diets also in even high protein diets can cause elevation in the blood pressure if your other habits are not very healthy. Lack of sleep also can lead to high blood pressure. Lack of exercise, sedentary lifestyle can lead to high blood pressure. Obesity, especially high waist to hip ratio, that means if you are more at waist, if you have a larger tummy compared to your hips, you are more likely to develop blood pressure. If you snore, if you have sleep apnea syndrome, then also you are more likely to have high blood pressure. And of course, habits, smoking and tobacco and alcohol can lead to high blood pressure, even at young age, even in 20s and 30s. Why should you be bothered about high blood pressure when you are young? It doesn't cause any problem. It doesn't lead to any symptoms. But many times this high blood pressure leads to stroke, heart attack, heart failure, etc. When your heart has to pump against high blood pressure, the muscles thicken, the walls thicken, and then eventually that can lead to heart failure at an older age. Plus, these high blood pressure causes your arteries or blood vessels to become narrow and stiff, and this leads to atherosclerosis, and atherosclerosis leads to heart attacks. Many times, unattended high blood pressure can lead to aneurysm formations and cerebral hemorrhages also, brain hemorrhages. If you have two or more risk factors for high blood pressure, if you have high blood pressure which is not very well controlled, if you have any evidence of organ damage, that is, if you have your retina which is showing signs of hypertension, if you have kidneys showing signs of hypertension, or a heart showing signs of hypertension, or if you have symptoms like breathlessness or chest pain or headaches, you should consult a doctor and seek medical treatment, not let your hypertension slide by, not let it go untreated. Many times we are asked questions, can hypertension be reversed, in especially young age? Yes, sometimes it can be reversed, especially if the blood pressure is secondary to some underlying condition like kidney problem or hormonal problem like thyroid or adrenal gland tumors, etc. Or if you have high blood pressure caused by certain inflammatory conditions or certain congenital conditions like coarctation of aorta or sometimes renal artery stenosis. These conditions, when they are cured, the hypertension can be cured. In some rare instances, even primary hypertension, that is hypertension without any underlying condition or without any cause, can also be reversed by proper lifestyle changes and loss of weight or weight reduction, etc., restricting salt intake. In some people, these changes can reverse the hypertension. But in many patients, you have to take the blood pressure medications lifelong. Many people do not take treatment thinking that if I start medication, I will have to continue it lifelong. It's not so. It is faulty logic. If you have blood pressure, if your blood pressure doesn't respond to anything else but medications, if your blood pressure gets controlled only by medications, then you have to continue medications lifelong. It's not fault of medications, it is the problem with the condition, that is hypertension, which needs treatment to prevent future complication. Mind you, as such, hypertension is not a disease, it is a problem which leads to diseases. And that's why hypertension needs to be treated so that we can prevent those bad outcomes like stroke, heart attacks, and heart failures, and kidney damage, etc. Folks, hypertension in young adults is a burning problem. So many, almost one estimate is that almost 50% of adults between age 20 and 40 will have at some point of time elevated blood pressure, somewhere between 120 to 130 or 120 to 140. And these are the patients, or these are the people who go on to develop high blood pressure in their older life, and that leads to cardiovascular complications and renal complications. So it is very important to identify hypertension in young adults and treat it so that we can prevent future complications and prevent not only loss of life but also loss of quality of life and loss of productive years of young individuals who benefit otherwise to society.